Well, hey everybody, Steph here. I've never done this before, and man, look at I'm getting old. I am talking today kind of about my health, and I don't normally do that, and I'm not doing this to have anyone feel sorry for me or any other reason really besides I feel like I need to tell my story just in case anybody else may need to hear it if they're going through something like what I'm going through. And the teacher in me just can't help to get information out there when something needs to be known to the world that's educating them. If those words make sense. But since about 2020, I started having some cardiovascular issues. And there's nothing wrong with the integrity of my heart or anything like that. I'm super fit. My heart muscle is A-okay. But since 2022, I've been passed around, misdiagnosed. I've had three ER visits in the last 2 weeks. 2 last year, 3 in 2022. Yeah, so it's been a lot. And what I think I have, based on research with the American Heart Association, who just 2 months ago started recognizing what I think I may have, as well as the American College of Cardiology just now kind of putting out guidelines. There's no guidelines for what's called recurrent pericarditis. Pericarditis is basically my lining around my heart muscle has fluid around it, or it's rubbing, or different things. Something's wrong with that lining, and it makes my heart beat super fast. It makes my blood pressure do crazy things up and down, and really high. Like the other night, 174 over, what was it, 115 or something, tachycardic. And it just comes on. This started happening, like I said, back in 2022 for me with chest pain. I thought I was having a heart attack. And feels like a snake's wrapped around my neck, radiates here down the left side. I mean, see what I'm saying? All the signs of a heart attack. That's what pericarditis is, basically. Chest pain, angina, followed by shortness of breath, fatigue. I mean, those of you who know me, I'm usually pretty active and happy to stay up. The last 3 or 4 years, by 8 o'clock, I'm in bed asleep. So yeah, it's changed my life a little bit. But in 2022, went to my PCP. That was then they thought maybe it was just blood pressure and stress, maybe, I don't know. But so that's when I got on blood pressure medicine. So went through a few months and, several months, several visits to my PCP. And then in October of 22, went to the ER at St. Anthony's, had chest x-ray, like all the signs and symptoms of a heart attack. Chest x-ray, ruled out everything in the world, okay? All the blood work. I have no cancer. I have no autoimmune disease. Everything's fine. EKG's fine. Doc says at the ER, maybe you pulled a muscle. Maybe you have what's called pleurisy. Oh, I have pleurisy. It's like an old lady disease, which almost 50 this year, so I'm getting out of breath just talking. So yeah, I don't know. So pleurisy. Oh gosh, so then fast forward about a year-ish from October of 22, going through all those visits to May of 2023. Go back to my PCP going, what is going on? My blood pressure keeps going up. It's like, this is not normal, whatever. Can't breathe, short of breath started happening. So the symptoms every time, what's called a flare happens with what I think I have, things get worse. And at that time, shortness of breath, EKG's fine, everything's still fine, blood work's fine, nothing wrong with you, let's put you on an inhaler. And steroids, and maybe it's allergies, Oklahoma, I don't know. Fast forward, February of 2024, go to the ER again, same stuff, same shit, different day. And went back to St. Anthony's. Never thought in the world to go to the heart hospital ever, because I was told my heart was fine, right? Second ER visit at St. Anthony's. Maybe this was the third, actually. No, second. Anyway, same thing. Everything's normal. Everything's fine. Different doctor, think I think I've got this figured out, ma'am. I think you do have pleurisy. Pleurisy, I've got the pleurisy. Fast forward, that was February of 24. Fast forward to May, some of you know I was in the hospital 3 days. Yeah, they ended up, EKG then was not fine. I was an AFib. Fluid on the heart, like a crazy amount. I had to have a chest tube put in. Pericardial centesis. Never thought I could even say that word. And here I had one. Yeah, but blood work fine. They tested the fluids fine. No cancer, no autoimmune, no answers, nothing. It's idiopathic bullshit. Meaning doctors don't know why it happened to me. They're calling it acute pericarditis. Probably won't ever happen to you again. Well, it did happen to me again. Fast forward to March 17th, right after St. Patrick's Day. Started feeling it. I'm like, oh, Kara, I think something's coming back. The python snakes returned to my neck. Slowly fast forward all the way to March 29th, Saturday. Another ER visit, but this time I go to the heart hospital because I'm thinking the heart hospital is heart doctors. Go to the heart hospital, everything's fine. EKG's fine. My chest pain's really bad, way worse even than the chest pain actually. This time around is way worse than when I was hospitalized. Mysteries, weirdness. I was told everything's fine. They did an echo and echocardiogram, and there is a small, what's called a pericardial effusion. Very small, but they call it physiologic, meaning probably normal. Well, is that not freaking causing my heart pain? Send me home on this regimen of stuff. Some of it, including the steroids, may or may not be harming me worse, making me worse. Was told, to follow up with my cardiologist. You would think, with the history, the cardiologist would get me in pretty quick, right? My cardiologist, who is the guy that kind of saved my life with the pericardial centesis, can't get me in till today. I go to see him today. So I go home on this colchicine that hurts my stomach, causes other crap. I get on some steroids. Day 3 of the steroids, my blood pressure is like crazy. Get off the steroids because I'm like, this shit's making it worse. According to the research I'm reading in your journal, Mr. Cardiology. And I'm no cardiologist, but I can read, and I used to teach statistics, so I know what a significant difference means and contraindication for steroids. Right? Anyway, a week later, April 5th, last Saturday, back to the ER. Thank you, my sister, for taking me, because we can't keep putting little Jameson through this and that sort of thing. So my sister takes me, Kara stays home with Jameson. Symptoms even worse, even worse. I literally thought for sure this effusion has grown. They're gonna have to stick another needle in my heart. I don't know what they're gonna do, what's happening. Nope. This doctor, which by the way, at this time, I figure out these ER docs at the heart hospital are DOs. Not cardiologists. And I said, oh, are you the cardiologist or the PA? Yes, I'm the cardiologist. Did I look him up? He's not a cardiologist. Credibility of heart hospital, up in the air at this point. Doesn't use the stethoscope to listen to my heart. Somebody with pericarditis has what's called a rub, which is one of the 4 criteria of acute pericarditis or recurrent pericarditis. The dude didn't even use a stethoscope. Told me he said, what is your goal of being here? Was rude, acted like I was a hypochondriac since I was there kind of the week before. I'm in pain, has me lay down while I'm getting an EKG, continues to talk to me during the EKG, which you're not supposed to, asking me questions. I don't know, it was so bizarre, and he was just totally rude. Told me to stop. I go, is this pericarditis? Is it returning? I need an echo done. Like, he wasn't going to run any tests. I go, I need an echo to make sure that small effusion hasn't grown from last week. So I kind of made him have to do the test. Again, you have to be an advocate for your own healthcare sometimes. He runs it. He said that there's nothing there. You don't have pericarditis. Stop calling it that, he tells me. sends me home, says, get off the steroids. I think you're just having a bad reaction to the steroids. I said, sir, I have been off the steroids. Or my sister jumped in and said this. She's been off of it since last Thursday. Looks like the shelf life's pretty quick on that. Why is her blood pressure so high? We don't know. And I said, well, why am I having chest pain? Why do I feel like this? I can't sleep at night because if it lays down, it's way worse. I cannot lay down. I have to sit up straight like this. He says, I don't know. Maybe years down the road, you're going to find out you have lupus or this or that. And maybe he's right, but don't be a dickhead. Sorry. Sends me home, follow up with my cardiologist, who still, even though now knows I've been to the ER twice, can't get me in until today, the 11th. The next day, it's even worse. I am scared. I feel my blood pressure's crazy numbers, like for me, crazy. I'm normally a 120 over maybe 70, 75. And I'm up there at 174, like stroke level, diastole, like 115 to 120. Like, I'm like, what the? So I go to, I'm like, I'm done with this heart hospital crap. I went to OU because I'm like, at least they do research and they have students and they're going to teach and probably going to use a stethoscope. So they were very awesome. And the PA there, I didn't even see a cardiologist. So that, not that DOs are bad. I'm not saying that, but I just had a assumption that you go to a heart hospital, you're seeing heart doctors in that ER. Maybe they call them in if, I don't know. But I didn't want to go back there. So I went to OU and got some emergency blood pressure medicine to help with that. She says, you know, I'm sorry what you went through. It doesn't sound like you were treated very well, but he's right. You have just a small effusion, blah, blah, blah. Follow up with your cardiologist. I was like, well, could I get a second opinion, a referral or whatever? She's like, I can get you a referral to an OU cardiologist and you can call and they'll also call you by me doing this referral. I got in the next day to OU cardiology. Dr. Murray, she was amazing, but she has never seen a case like this before. It's so rare. She said it'd probably take about 6 months to get all the testing. Anyway, that's what I'm going through. I'm going to the Mayo Clinic, which has a pericardial disease center, and I'll be right back for part 2.